Drugs in sports. What is drugs in sports? Drugs in sports, also known as doping, is the abuse of chemical substances in order to enhance physical and mental performance, and this has become an increasing issue in recent years. Many argue and debate about why doping should be legalized and why it should stay banned. But what exactly makes drugs in sports a problem in the sports world and in society? The problem of doping is not an educational, economic, or a social problem, but a moral problem. The fundamental idea of sport is considered to be character building. Sport teaches commitment, perseverance, adaptability, endurance, self-discipline, and many other different morals and virtues. It integrates individuals to bring about a healthy, integrated society. This means that the abuse of drugs and other chemical substances should by all means not have a play in this. All athletes should have equal justice and conditions. Unfortunately, doping is widespread in the world of sports. It has highly dangerous derogatory effects on both the user and the onlookers. Doping puts the health of the user at risk, and many ethical problems arise because of this. From expectations of the public to the internal competitive character of the athlete, many things can push an athlete to such lengths. But in order to understand this, it is necessary to understand where this originated from. The history of drugs in sports. The use of chemical substances in order to enhance performance dates back to ancient Greece as early as 300 BC. The first known death of an athlete, which was related to drugs, was after a cyclist had taken high doses of heroin and cocaine in 1904. By the 1920s, it had become evident that restrictions regarding drug use in sports were necessary, and the Dangerous Drugs Act was formed and was implemented in 1921. After the deaths and hospitalization of several athletes resulting from clinical drug abuse in the 1960s, the sports world prompted the development of anti-doping legislation, and the first drug testing procedures were implemented at the Olympic Games in 1968. But have these implementations been effective? What kind of doping drugs are most commonly used? There are 5 main general commonly used substances for doping. Anabolic steroids, stimulants, narcotic analgesics, beta blockers, and diuretics are the main kinds of drugs used in sports. Anabolic steroids, a catalyst in the construction of muscle mass. It allows the athlete to train harder and recover quickly. Stimulants, a catalyst in getting messages through the complex pathways of neurons to the brainstem. It allows athletes to be more alert and masks fatigue. It is used in intense sports such as running, swimming, and cycling. Narcotic analgesics, everyday painkillers, but these are banned substances as they allow an athlete to ignore muscle strain or an injury. It masks pain and fatigue caused by injury or strain. Beta blockers, depressants which lower heart rate and blood pressure. It lowers heart rate, which reduces nervousness, and is used in performing or crowd sports such as gymnastics and archery. Diuretics, speeds up the waste disposal process to reduce blood levels, used in weight-controlled sports. How widespread is doping in the sports world today? The World Anti-Doping Agency had a global testing of banned substances in athletes in 2012. 300,000 samples from all sports were tested, and these were analyzed by accredited laboratories. 1.19% of them tested positive for banned substances. That means an estimated 3,600 athletes tested positive for having used banned substances. Reasons for drugs in sports. Why do athletes resort to doping in the first place? Why do people use drugs to enhance physical performance? Pressure. Pressure is one of the major reasons that athletes go to such extents. What kind of pressure, you ask? There's media pressure, social pressure, public expectations, and coaching expectations. All these kinds of pressure can push athletes to such a length. Corruption is also another major reason, such as unethical practices and under-the-table deals by national and sport federations. The consequences. Legal consequences. Let's look at the big picture now. In the sports world, doping even occurs in the Olympic Games. If an athlete is caught before the games commence, he or she is simply suspended from competition, typically for 6 months or more. But if an athlete is found to have cheated in an actual competition, then any medals are forfeited and the results are recalculated. Is this all? Health consequences. Doping often ends in grave health consequences, and many can lead to severe health issues or even death. Health issues that may result from doping often include abnormal growth of organs, cardiac problems, psychological disorders, libido disorders, brain damage, overproduction of the wrong sex hormone in males and females, and many other health problems. These problems do not necessarily appear right after a use, but may gradually make a severe impact with prolonged or strong uses. Evaluation. Is doping right? Should doping be legalized? Is doping worth it? No. Doping is never right and will definitely never be worth it. Sacrificing your own safety and health for the sake of winning is never worth it. What's more, the old conventional ethical morals and virtues, once supported by sports, is now dying and is losing its place to competitiveness and lust for money. And this needs to be stopped